Greetings and welcome to another episode of Super Speak Sundays. I'm your host, James the Orator. And as you know, we always highlight ordinary people who are doing extraordinary things. That's the platform for this show. Don't know what's going on with other shows, but that's the platform for this show, Super Speak Sundays. Hope everyone is doing well. Thank you for tuning in again for Super Speak Sundays. We have just been overwhelmed with the number of guests we've had on our show. We've had some really interesting guests. If you go back to episode number 1, we had Keith, the RV guy, who is a minority-owned, Black-owned RV rental and sales business. And so, with it being summer and, things are starting to get a little bit warmer, we definitely want to encourage you to visit touchdownrv.com, touchdownrv.com to rent an RV. It's a great experience. Hey, you know what? As I woke up this morning, I had to take some time to reflect on how I was feeling. I was thankful to be in my right mind. I had all my limbs are still moving, and I can think clearly. And sometimes, we take those things for granted. Today we have a special guest. This person has a testimony, a story to tell, and it's like no other. And we want to introduce you to her. Zakiya Jenkins has taken action to improve her personal health. She has gone from 3 hospital visits per month to teaching 6 fitness classes per week. In her moment of transition, she weighed over 300 pounds and suffered from chronic health conditions. She's committed to making a lifestyle change. She lost 80 pounds and decreased 10 dress sizes. She can now attest to having more energy, decreased health insurance costs, and less aches and pains. Zakiya believes that access to health resources and education can change a person's life. She is motivated to connect with individuals and support them through a newfound health journey. As a result of her personal health journey and a willingness to live a healthy lifestyle, she founded Grace Fitness, a nonprofit organization that provides access and opportunity to those seeking a healthier lifestyle. Prior to founding Grace Fitness, Zakiya worked as a clinical director for a community-based health system. She understands that the struggle that both providers and patients face regarding education, treatment, access, and compliance. In addition, she has a master's degree from Upper Iowa University in public administration, with an emphasis on nonprofit management. She is certified through the National Academy of Sports Medicine as a personal trainer and is a fitness writer for Urban City magazine. Ladies and gentlemen, help me welcome Ms. Zakiya Jenkins.
Hello, everyone. Hello.
Hey. How you doing, Zakiya?
Good. Thanks for having me.
Hey, thank you for being here. Thanks for being another guest on Super Speak Sundays. This is, we always try to create an atmosphere where people have opportunities to take things away, to learn from our guests, because we all have a journey that we have traveled. And some part of our journeys have been great, and there have been times when it hasn't been so great. Before we get into the meat and potatoes of your story and what you're going to discuss today, we always start with a quote, and we want to give you your quote. Once you see this quote, I'm going to read it, and then we want to just get your initial feedback on your thoughts, okay?
Okay.
So the quote says, "Every day is another chance to get stronger, to eat better, to live healthier, and to be the best version of you." And that's an unknown artist. What are your thoughts?
I love that. I love it because it's true, and that's why I named my nonprofit Grace Fitness, because on that principle, God gives us new graces and mercies every day to live a healthier lifestyle, right? If you get that meal, if you out of control on one meal, don't give up and just keep going over and over. Give yourself some grace to know that you can start over. Every day is a new day to start over.
Absolutely. And I think sometimes we take that for granted, that every day we wake up, we do have another opportunity to start over Every day is a fresh start. Take us back to growing up in Gary, Indiana. What were things like for you, and how did you get on this journey of health and fitness?
Oh my God. Gary was, Gary has his good and bad qualities, right? We
Sure.
we know that Gary taught me my life skills. Gary taught me my character and my integrity and my resilience by
Sure.
living in that city. And I love Gary, right? But what I do know is we never talked about health. When I was at my grandma Nanny Bell, when I was at her kitchen table or in the
Right.
kitchen, I never ever heard conversations about health, improving health.
Hmm.
And I heard that cousins had the sugars and not
Right.
knowing that really the sugars meant you had diabetes,
That's right. Right.
right? But we never talked about that. So I really want to change that narrative but Gary was great. Like my family still, some of my family is still there, my friends.
Right.
Yeah, it was cool, but it taught me who I am and what I am today. And I wouldn't have
Absolutely.
changed where I grew up ever.
Right. I would definitely agree. Again, we're both from the same city, and we both know that there are some great people and great things that have transitioned and been created in Gary, Indiana. Let's go to so after you left high school in Gary, so you live in Iowa now, right?
Yep,
Is that right? And
yep.
so and so and so how did you transition from Gary, Indiana, and then get into Iowa?
Now, it's just a lot of things happened. My dad died when I was 18. I was in college at Indiana State University in Terre
Mhm.
Haute, Indiana. And my freshman year, my dad passed away unexpectedly of
Sure.
HIV.
Right.
And so when I came back, my mom, my Aunt Rosa lives up here. She went to Drake University.
Mhm.
And Gary a little rough now, I'm keeping it real. And
Yeah. Oh yeah.
so my mom, she just wanted a better life for herself. And so she moved up here for a better job. I
Right.
wanted to move to Indianapolis. And she was like, no, if you want a apartment, you got to move here to Iowa with me. So that's how I got here to Iowa. Not a lot of Black people, the population is not
Sure.
like Gary, right? It's
Sure.
not like Indianapolis, but there are Black people here. I get that all the time. There's Black people in Iowa. Yes, there are.
Yeah.
Um,
Yeah.
but it's safe too. It's safe, and people, they help you here. You got
Sure.
good programs and opportunity, and that's what I like.
Sure. Sure. Now as people see you now, they see your face on camera. A few years ago, you were a different person.
Oh,
Talk a little bit about that.
a few years ago, I would say starting in 2017, my life started to change because I'm a new person because I discovered myself in health.
Hmm.
But prior to 2017, I was not taking care of myself. I was just eating what I wanted, fast food, drinking as much as I wanted, not exercising. It was just bad. And so that led me to really put on about 100 pounds. I was in a domestic situation. And so, I have been molested, so I
Sure.
had all these feelings that I did not deal with. And instead of me forgiving myself and forgiving others that hurt me, I ran to food to comfort me. I
Wow.
ran to food just really because I was hurt and I didn't know what
Sure.
to do. And not knowing that my relationship with food was hurting me. Because I was,
Right.
like you said in my bio, acute asthmatic. I couldn't walk from here to the corner
Wow.
without hitting an inhaler or my knees hurting.
Right.
And so I just had to really look at myself. And what changed in 2017, I went to the Bahamas, my first trip out of the country. And
Hmm.
at 305 pounds, I wanted to stay in my cabin, right? My friends had on a two-piece bikini, and
Yeah.
I'm in a 3X, 4X swimsuit. So I just wanted to just stay in my room. And I'm like, this isn't the way to live. I want to enjoy life. But I
Sure.
knew in order for me to enjoy life, I had to look at myself deep down and figure out what was bothering me to where I have this bad relationship with food, a
Sure.
bad relationship with not caring for myself,
Right.
self-care,
Right.
taking time for me, right? I was not being selfish with my
Okay.
time. And a lot of people don't know that it's okay to not be all for everybody and not be there for yourself.
Sure, sure. Now,
No,
you mentioned a couple of things. You talked about being in a difficult relationship, and then you talked about molestation. Would you equate those things? So when we see people who are overweight, or maybe they're using drugs or alcohol, would you equate those things to dealing, not dealing with some of the past hurts and pains that they've experienced?
absolutely. Absolutely. Because I didn't know the trauma. We just move on from trauma to trauma to trauma to
Yes.
trauma and not address them. And I was addressing them by not loving me. I was not loving me. And I had to, my pastor, it happened like 2018. My pastor chose me out of hundreds of people to wash my feet.
Mm,
At that time in my life, that's when things transitioned
sure.
after the foot washing, after the Bahamas trip. Those are little things that God just, he maneuvers in the background. Me not even knowing about Grace Fitness. Grace
Yeah.
Fitness was nowhere on my radar because
Right.
I'm getting myself healthy and fine. And once my pastor washed my feet, something happened. Like
Yeah.
from my mental all the way to
Yeah.
my spiritual. I let it go. I let whatever somebody has done to me and what I've done to somebody, because I'm
Yeah.
not perfect either, right?
Right.
I'm not confessing that I'm perfect, but I had to let it go. I had to really let it go, and that just that changed my life. So I encourage people to seek help, seek some therapy. I
Sure.
know
Sure.
in the Black community, therapy could be shunned upon because what stays in your house stays in your
That's
house.
right. That's
Nobody
right.
needs to know. And that is the furthest thing from the truth, because sometimes you need to talk to somebody to share what has happened to you so that you can live and not hurt yourself because of trauma that has happened. But I learned that this isn't a overnight thing.
Absolutely.
Yeah,
I want to show the picture of I don't know if were you in the Bahamas here?
yeah, I was.
Okay.
Yeah,
If
yeah.
you would move over just a little bit to your right.
Oh, to
Oh,
my right.
yeah, yeah, there you go. Just so
Yeah,
we can
okay.
so the picture can be here in
Yeah,
between us here. So
yeah.
so tell us what was going on. Who is this person?
Oh my God, that person, she was hurt. She was unhappy. She was a people pleaser. She didn't learn the art of saying no and learning that no is a complete sentence,
Hmm.
right? And that person there, I just wasn't happy. I didn't exercise. I just didn't feel good inside,
Hmm.
right? And I was going, that dress was maybe a size 24, maybe
Okay.
24, 26.
Right.
Yeah, so that's,
Do you still have that dress?
I don't, but I have a sweatshirt that I will never get rid of because I was at the Iowa State Fair and I split my pants and I had to go into this shop and I had to get a 4X shirt. And that was tight. That was kind of tight to wrap around my pants. And I get choked up. Woo!
Yeah. Yeah.
I really get choked up thinking about it because I am not that person. And I'm thankful that I'm not. Right?
Right. One thing I noticed about the picture, even though you may not have been in the best place mentally or even physically, you still have a smile on your face. And oftentimes in life, people will smile and people will act as though things are going well, but they may not be okay inside. I mean, what is your message to them?
Oh, don't give up. And once again, seek help and seek support because that's true. You do smile inside and you hurting inside. And that's why people run the food. That's why they run the alcohol. That's why they run the drugs. Everything, you can do everything in moderation, right? And I
Right.
had to learn that. Even if you drink, you don't have to go hard all the time. Just make it casual and make it to where it's not hurting you. It's not hurting your kidneys. It's not hurting you. So you can live a long, prosperous life. And at that weight and in that picture, I was on the verge of dying because my kidneys were failing. I'm heavy. I'm
Yeah.
carrying the weight of 2 people,
Sure.
right?
Sure.
And I'm not about bashing BBWs. Cause I'm not a skinny woman now, but I'm
Mhm.
healthier. I could
Sure.
run. I don't go see my asthma doctor. I don't have to take medicine, cause you can be thick, but you have to move, and you have to eat right. And you have to get your preventative checkups and know your
Sure.
numbers.
Absolutely. Now I
Yeah.
want to show you. I want to show you another picture, and this is who
Ooh,
you are today.
yeah.
That's
Yeah.
who you are today. Now, who is she?
Oh my God. She is more confident. She loves herself. Um, she's resilient. And I know that, right? I get to look back over my life and know when people say, what don't kill you make you stronger,
Mhm.
that is not just a saying, because it is true, you know. And so in this picture, I'm happy, right? I'm confident, and I
Mhm.
could go into a store. I don't have to just go into a plus size store now,
Right.
but that took time, because I was still overweight in my mind. Even when I became skinnier, I still gravitated to the plus size because I was
Sure.
just there for so many years. So I had
Sure.
to really be like, no, I don't have to shop plus size no more. I
Right.
can go into any store and buy me some clothes. And that's just an added benefit to getting healthy. Your clothes are cheaper, right? All that, you feel better in your clothes. You
Right.
have confidence to be in any room with anybody.
How have things changed in terms of, of course, men, and forgive me for this, and any women who are listening, but men will say, thick thighs save lives.
Yeah.
Now that you have lost the weight and you feel more confident and you're glowing, what does that mean for relationships for you now?
Thick thighs does save lives, so that saying is true. But you want healthy thick thighs.
There
But
you go.
for me, I am just navigating. I'm recently divorced, so I am just navigating being single, and once again, still caring for myself and
Sure.
making sure that I'm safe. I'm practicing safe sex, and I'm doing all the things, because
Right.
it's hard out here, right? I get that, but you just have to take care of yourself. It's no other way, because you
Right.
only get one body. You can't buy another body. You
That's
can't
right.
buy kidneys. You can't, like, truly, you cannot take your body for granted.
That's right. That's right. On the tickler, on the tickler, we have Grace Fitness and your website.
Yeah.
Talk a little bit about what people will see when they visit the website, and talk a little bit about some of your programs.
Oh my God. So I'm gonna back up a little bit. So
Okay.
in my 305-pound stage, I started teaching, even though I was heavy. I still was like, I still need to teach. And I did. And so as I was looking to help me, I
Mhm.
couldn't find a Black person that looked like, I couldn't find support that looked like me,
Right.
that I could go to and say, hey, I need some help. I don't
Right.
know what to eat for dinner. I just don't know what to do. And so I founded Grace Fitness in 2019 for that very reason,
Mhm.
as a support system for people trying to lose weight. Because if you've never been overweight, that is one of the hardest things you will ever do in your life. One, because food is good.
Right.
Two, we haven't been taught calories and reading your food labels, and eating this over that. That just didn't happen in my family.
Right.
And so founding Grace Fitness, it helped me, right? And it still does to this day. It
Sure.
makes
Sure.
me stay accountable. And I think, and I'm thankful for God for that. But what people will see when they visit the website is some of the events that I've done, um, programs. So I just been blessed. I have been blessed
Yeah.
to. I just received certification through the Centers for Disease Control to start a
CDC. Yeah.
diabetic prevention program. And that
Wow.
is huge, because this can be virtual, it could be in person. And that's what Grace Fitness needed. In these 2 years of me, being a nonprofit, I'm still walking through and learning how
Right.
to
Right.
own a nonprofit, what that looks like, and
Sure.
And so I didn't have a solid program, in my opinion, to help
Mhm.
people. And so when the Iowa Department of Public Health heard about me and they approached me, and it was like, we think your organization will be a good candidate to be a diabetes
Oh yeah.
prevention program. And I'm like, absolutely. So we went through a 2-day training. And now this is going to set me apart uh, from my competition because it's focused on my Black people. And one,
Right.
let me make this caveat. I'm not saying a white person can't come because I do
Right.
have white clients, but my focus is on my people because
Right.
I know all the social determinants of health that
Health.
I
Yeah.
face and that my brother faced and my cousins face and my
Right.
friends face. So I'm just out here really grinding health. I don't sell no products. I don't have no waist trainers. I don't have no diet pills. The only thing that I sell is a lifestyle change, and people have to put in that work though. And I just help them. I share the recipes that has helped me over these years, right? So it is just, it's been amazing, and the response has been overwhelming. I've helped people in Chicago and
Yeah.
California, just in Texas. So it's just because of COVID, it
Sure.
opened me up, right? I
Wow.
was so closed minded. I'm thinking just about Des Moines, but
Right.
because of COVID, now my reach is so much grander.
Wow.
Yeah.
Wow. And you know what? There will be people throughout this country who watch this podcast or this recording. Talk about how you establish your virtual programs, because there may be someone who says, "Hey, I'm listening. Hey, I saw these pictures. I saw the before and after. Hey, I want that in my life." How can people get involved in the virtual part of your programs?
They reach out to me and we have an initial conversation because I want to what I also learned is every person isn't I can't help everybody. So
Right.
I have that initial meeting to check in and see what their goals are and to see if I can help them, right? So they could go on my website and leave me a message and I'll reach back out to them. It's really that plain and simple. And then we work through the program that I'm doing. It is a year-long program. And to
Okay.
some people, that's long, but not really, because you're worth it. And you're trying to establish a lifestyle change, no quick gimmicks,
Sure.
because you want to live in your body and you want to have a healthy relationship with food for the rest of your life. And you don't have to compromise or sacrifice doing that because it
Sure.
shouldn't be another job. Because if it's another job, people aren't going to stick with it. And I found that for myself, like all that counting calories, I don't
Yeah.
have time for that. I'm busy.
Right.
Yeah.
Exactly. Exactly. And so now you've established a system. You have a system in place, not just an organization. You've created a system where you are changing the lives of many people. Talk about the most important part, and that's being able to transition the mind, because the mind is so powerful. But being able to take the mind and change the mind. If we've been doing something for 30 years, 40 years, 50 years, and you don't have to give it all away, because I know we want people to come and visit your website, but just kind of talk about maybe one or two things that are important as we start that transition of the mind
Yeah.
to a healthier lifestyle.
Absolutely. My number one is strive for progress, not perfection.
Okay.
Right. And number two, you got this. That's it. And to take the negative thought, that's what I really had to overcome, is the negative thinking in my mind about
Mhm.
the what ifs.
Right.
You're not going to be able to lose all this weight. You got too much to lose. Ain't no way, and people are mean to you when you're
Yes.
overweight. They say little slick slide comments and that just steady tears you down.
Mhm.
But what I suggest to people, I fill myself up. If that's listening to, spiritual music or whatever it is to fill you up and
Yeah.
to get rid of those negative thoughts, because that keeps people stuck. Here you go again. You on a path good Monday through Friday, and then here's the weekend. So you sabotage all your work, and your back of your mind is saying, here you go again. I told you
Yeah.
ain't gonna be able to accomplish that. So you really have to talk to yourself and say, yes, I am. This is just one bad meal. and I got this. And my, for real, my slogan is, and my anchor that keeps me anchored is strive for progress, not perfection. Because you'll never be perfect at
Sure.
eating healthier. You'll never be perfect at, working out 5 days a week. But I will say that it is worth it to invest in yourself. Invest
Sure.
in you, like we get our hair done. Invest in you a gym membership. Invest in your health. Get your preventative checkups. Make sure you know if you
Right.
have diabetes. Make sure you know if you don't have hypertension, high blood
That's
pressure.
right.
You
That's
have
right.
to know. You got to know how much you weigh. You do, right?
Right.
So I
Oh
just
yeah.
think those things, and don't be afraid, because you can't say what if, because negatively, because what if was a good thing.
That's right.
If I wouldn't have, if I would have at 300 pounds not took the leap of faith, God telling me, I want you to get healthy, I want you to strive for progress, not
Right.
perfection, I wouldn't be on this platform with you today, because I
Absolutely.
I would have given up. And that's the worst thing somebody can do. Don't give up on your health. Don't give
Right.
up on you. That's
Right.
where I'm at.
Absolutely. Absolutely. I'm thinking about just listening to some of the words you're saying. If you had not been 300 pounds, there would not have been a reason to create Grace Fitness.
Absolutely.
And so a lot of times, as we live in our mess and we live in in our times of despair, we
Mhm.
don't know what's going to come on the other side of that. And so that is a word for people to be encouraged, because you know you might have gone through a, not you, but I'm just saying people may have gone through a bad relationship or whatever it may have been.
Mhm.
Understand that as long as you wake up every morning, there's an opportunity to start over and to be able to create something as a result of what you've gone through.
That's right. And, learn to eat this over that. Like, I love, in the Black community, we love greens with the smoked ham hock and all of the bacon grease.
Right, right.
But now I had to learn to eat it a little healthier, still make my greens, but instead of having that pork hock, I get a
Mhm.
smoked turkey drumstick, same flavor,
Sure,
same,
sure.
and even watching your salt and your sugar. Like, truly, don't drink your
Calories.
calories. Yeah, don't drink and it's just little tips that Grace Fitness we share to help encourage and let you know. For me, I've been there, so I'm still there. How about
Sure,
that?
sure,
And
sure.
like I said, it's an ever evolving door to your health. It's never a closed circle,
Oh
ever.
yeah. One of the things I noticed in reading your bio, you went on to get your master's degree in nonprofit management, but now you're currently in school. You're looking to expand what you're doing. You're looking to give people other pieces of the pie, which that's lightly used. We're talking about pie. So talk about what you're doing in terms of enhancing your education to improve the lives of others.
Absolutely. So, 2 years ago, I was in the kitchen and God said, I want you to go back to school. And I had
Mhm.
my arms crossed. I was at the kitchen counter. I'm like, nope, I ain't doing that, because I'm out getting my master's degree. It was
Yeah.
tough, right? So
Oh
I'm
yeah.
like, I'm not going back to school, because I knew it was a 4-year thing, and I don't want to do it.
Right.
So, but why I am in school and God won is because there's no Black registered dietitians in Iowa.
Hmm.
And so I saw a need in my community.
That's right.
One, to help people, and two, to help myself. Like I said in the opening, sitting around my grandma's table, we didn't talk about food and
Right.
what's in there. What she is that too much salt, grandma, or
Sure. Sure.
but that could have contributed to her having gout, right? Like,
Mhm.
we just have so many family chronic diseases that we
Sure.
just assume we'll get because my grandma got. And you
Right.
will have it if you eat like them. And if you
That's
don't
right.
exercise, of course you're gonna have those same um illnesses. But I went back to school to become a registered dietitian to really help me learn to eat so I can help other people. And in the registered dietitian field, African Americans only make up like 3% of the
Wow.
Yeah,
Wow.
that is a gap in care. And like
That's it.
true. But our counterparts, our white counterparts, know the value of having a dietitian at their grocery stores that they can
Hmm.
pop in and they can be consulted. But in our community, we don't. I bet a lot of people may not even know what a registered dietitian is.
Sure, sure. You know, sometimes in urban communities, and we're talking about, where, the poverty line is is quite low.
Mhm.
Oftentimes, you have what we call food deserts where there are no grocery stores that may be in that area. What alternatives do these families have in terms of you know putting the right foods on the table?
Absolutely. So that's a great question. One, I think about this all the time and I teach this. So, say for instance, you getting your food from a food pantry.
Hmm.
We know that that's needed in today's time. So if you eating your vegetables out of can, you need to wash those off, rinse them off before you cook them.
Hmm.
Read your labels. I live in a food desert right now, so you have to really be strategic in going to the grocery store, making sure that I teach people to shop on the outside perimeter of the grocery store because that's where
Right,
all your fruits are, your meats, your milk, your dairy. Because once you start going into the inside is where all those processed foods are, the
right,
bread,
right.
all those quick meals. And you need to really you need to read your food labels. But once again, people don't know that. Even if they flip it over, they don't know what they're looking at. But that's what Grace Fitness helps with, is to give you that foundation to help you make a wiser food choice, right? Because
Absolutely. Yeah.
if you flip over a box of anything and it has over 50 ingredients and the total fat is 35 grams for one thing and you eating
Yeah.
that for breakfast, it doesn't set you up, your body up, to work well for you. It
Right.
makes you feel sluggish, you put on extra weight.
Right.
So it's a lot to it, but that's what Grace Fitness is here for, to help people navigate healthy relationships with food and exercise because it's hard.
It is. It
It
is.
is keeping it real. If
Yeah.
we, but once we know better, we do better.
We do better. That's right.
And
That's
that's
right.
what I know for sure.
Yeah, I can remember growing up and going down south as a child and witnessing, my family members having corn and
Mm.
they growing their own food. Have you any thoughts? And I don't know if you've done this already, but any thoughts about a farmer's market in your area?
We do have a farmer's market, but I have not. You can only, for me, I can only take on so much.
Oh
You
yeah,
know,
yeah, I understand.
in my strategic plan, I want to have a healthy food pantry,
Hmm.
right? Because that's important. If you can't afford food, let me help you have a healthy options to choose from, because I understand being in lack. We were poor growing up, right? And I tell people the worst thing you could tell your children, and even for adults, you have to clean your plate. That is
That's
to
right.
tell a child
That's right.
that you have to eat everything on your plate. What if that child's full?
Right.
Right, you're not helping them realize their fullness, because then they start to overstuff themselves, and then that exacerbates unhealthy relationships with food. So you
Yes.
really just have to, but once again, we don't know, because sometimes we didn't know where our next meal was coming from, so you
Right.
better eat that because you don't
Oh
know if
yeah.
you'll be able to eat again.
Oh yeah. Oh yeah. Yeah. You didn't throw food away. You
Yeah,
didn't
no,
throw
you
food
don't,
away. I
don't,
mean
but
that.
save it. Save it
Yeah.
for later. That
Right.
cuts your cost of your food, right? So you have to find your sense of fullness, and you don't have to clean your plate. And I tell people, your body isn't a garbage can, and
Right.
don't treat it as such. I had to learn that. My body is not storing garbage, and that
Right.
is extra food. If I'm full, I don't have to stuff myself and just be
Right.
in a food coma. I'll
Right.
save it for later, right?
Right. That's
You know,
exactly what it feels like too. Like you
yeah,
just and then, and then
yeah.
and then you go to sleep on top of it, and then before you know it, I mean, you're
And
not
then you
moving.
get acid reflux because you
Yeah.
didn't want to sleep
Yeah.
on a full stomach. Those are things that we
Sedentary lifestyle. Yeah.
in our community we have to change. because food has, and I'm going to say this real quick before I forget. So my
Mhm.
Aunt Neanza Washington, she died when she was maybe in her early 50s from
Mhm.
diet complications of diabetes.
Mhm.
And so I asked her, I said, Auntie, why uh, when you were pre-diabetic, why didn't you change your lifestyle? And she said, honey, I was just too busy taking care of other people because my Uncle Dwight was in a
Yeah,
wheelchair. And,
yeah, yeah,
she
right,
was just so busy taking care of other people. And that resonated with me because I'm her. I'm
right.
so busy being a mom, a business owner. At the time, I was a wife,
Sure.
you just, and a friend. So we wear all these hats, but
Right.
the most important hat that we have to wear is for ourselves,
That's
because
right.
you cannot pour from an empty cup, and you have to treat your body with care. You got to love you.
That's
Otherwise,
right.
nobody else going to love you.
That's
You
right.
have to
That's right.
be your number one priority. But I had
Absolutely.
to learn that because I wasn't. And when she died, I saw it because I took care of her toward the end of her life. And
Mhm.
she lost her eyesight, she lost her
Right.
leg, and at the end, she lost her ability to pee, all because of her lifestyle, not exercising and not eating healthy. And but
Wow.
but what that said to me is, I don't want to be like that. I don't want to
That's right.
be in my 50s and dead
Right.
because I'm not eating right and I'm not exercising, because we can prevent that.
Absolutely.
Yeah.
Absolutely. Wow, that's something. It's something. Again, as you think about the way we're raised in the Black community. Yes, eat
Mhm.
all your food,
Mhm.
eat what's put in front of you. You don't
Mhm.
have any choices. I mean, this is what's for dinner,
That's
and
right.
you're going to eat it. Real quick before we go, so Grace Fitness, do you serve men as well, or is this just for? I mean,
No, I serve men as well, and I want to serve my men because I don't think y'all get loved on enough, right? I think because men struggle with their weight just
sure,
as well as
sure,
women, so it is definitely men and women, and eventually children. But I know for me, I have to address the head of household because they're
right,
the ones doing the grocery shopping, they're the ones cooking,
right.
but childhood obesity is on the rise. These
Oh yeah,
kids are eating noodles that have
yes,
like 1,500 grams of salt, and you shouldn't
yes,
have that
yes,
all day, right?
yes,
But that's easy. That's a 19-cent meal you give your kids, but
right,
that's not the healthiest. But I
yeah,
get the month, and nobody's really talking. Sure, that ways for you to eat healthier, and that Race Fitness help you with. We provide opportunity to resources to get you healthy. I'm the connector. That's what I do. I'm a
that's
connector to
good.
health.
Well, we appreciate you. We appreciate you. Last thing, there is a man, woman, child who's watching this video, and they're struggling with their weight. They are struggling with childhood trauma that they
Mhm.
have not addressed. What do you tell them moving forward, starting tomorrow, starting today? What do
Yeah.
you tell them?
And I'm so glad you said that. You start today. People put off their health to next week. I'm going to work out. I'm going to start my health journey next week. No, you start today because tomorrow isn't promised,
That's right.
right? You don't put off what you can do today, tomorrow.
Right.
And little steps. What I want to tell them, start small. Don't try to go out and run a 5K. If you haven't done any exercise, start with 10 minutes
Right.
and maybe do that twice a day. Find something that you love to do, what brings you joy. You need
That's
something
right.
that brings you joy to do. So start small. Don't try to do everything. Don't try to start drinking 100 ounces of water if you're not
Right.
drinking any,
Right.
right? Start at 20 ounces. Let that be your goal for the week.
Sure.
Every week, have a goal to improve your health. That way, once you master that, that's out, that's done. And then you
Right.
move on to something else. It's little incremental steps to get you to the grand finale. And you'll never do that. And
Right.
don't let the scale dictate who you are.
Wow.
Don't
That's
let, because
big.
that scale it could be defeating if that you didn't put in all this work and you thought you didn't lost 20 pounds and you
Right.
gained two. right? Keep it up. Just keep moving.
Wow.
And one day you're gonna wake up and you're gonna feel better and you're gonna look better and you're gonna be so proud of yourself, because it's not about the end, is where you are in between and who you become
Right.
from you taking time for you.
Absolutely. We have to learn to live in the current moment. We have to learn to
Yeah.
live in the current moment. That's a whole
Yeah.
nother conversation.
That's
But look, hey, Zakiya, we definitely appreciate you today. I think that you've given us some nuggets, some things to really think about. There are people out there who are overweight and
Mhm.
who need to deal with things. And I think that you've given, not only have you talked about your own personal journey, but you've given us some information about how to measure, how to handle food intake and things of that nature. This, I'm for sure that someone out there will contact Grace Fitness and be blessed by the information that you've provided. So
And
again, we want to thank you. We want to thank you today for coming.
thank you. And I'm here, right? This is what I do full time, and I'm here to help. And I hope that if a person is at their wits end, that they reach out, because I know I was, and I wish Grace Fitness was around when I was at my wits end.
All right. All right. Well, again, thank you.
Yeah,
We will talk to you soon.
thanks a lot. Have a good one.
All right. You too. Bye-bye.
Bye.
Ladies and gentlemen, sometimes we have to look in the mirror, and not just look in the mirror and look at our physical bodies, but we have to look at our minds and to determine what are those things that are holding us back from transitioning to where we're supposed to be. Life is difficult. We have barriers, but how are you going to deal with those barriers? Are you going to let them keep you from becoming who you need to be? I sure hope not. Grace Fitness has given us a recipe for success, and we want to make sure that that's why we do these shows, because we want to make sure that you have all the information you need to be the greatest person that God created you to be. We love you, right? Until next time, I'm your host, James the Orator. You've been listening to Super Speak Sundays. We'll see you next time. Oops, hit my glasses. Peace.